Okay, recording. Okay. Well, thank you everyone for coming, for joining this seminar, webinar, and thank you, Pauline, for the great introduction. So, without further ado, we'll get started. Okay, so let's talk about what the acupressure is, right? So it is one of the many treatment modalities that traditional Chinese medicine has, right? So alongside with acupuncture, herbal medicine, cupping, acupressure is one of the common one that we use. So it's a simulation of points, these acupoints, by applying pressure, right? So mostly with the fingers. Some practitioners like to use some tools as well, but fingers, because they're most readily available, are the most common tool per se that used for acupressure. If done right and you do it regular, you have to do it regularly, right? So if you do it in regular interval, then the acupressure can actually be very effective and then have a great therapeutic effect. All right, so just a quick explanation on acupoints, right? So the acupoints are located all over your body, right? So they are located along the channel slash meridian, so they are like a energy pathway, right? So when you see the diagram on the right, you have these lines that connects the dots in different color, right? So they are different meridian that connects different part of the body, right? And the dots on these lines are the different acupoints. So when you find these acupoints, some of the acupoints can be more tender or sensitive than the other, um, which not always the case. But let's say you're pressing the acupoints for headache, right? And you happen to have headache that day, then this point can be more sensitive that day compared to other points. So that's something that you can look forward to. Also, with practice, as you start palpating your points and then you do the pressure every day, you will be able to increase your finger sensitivity, because a lot of these points are actually they are located on very slight or subtle depression on the body, right? So that's how the practitioners know they found the right place when they palpate on the body. So even yourself, when you practice on yourself over and over, you may be able to feel this depression. So that's something that will come in practice though. All right, so people always ask me like, oh, how does this acupuncture works, right? Like, how does this points work? So, I don't think this analogy is for everyone, but I like to explain it by comparing our body to a very sophisticated machine, right? So, I mean, our body is actually a very sophisticated machine, right? So, you have this different organ there, like different part of the machine, right? So, and you have these channels meridian. There are like electric circuits that connects or tubes that connects the different part of the machine, right? And then you can imagine these points, the acupoints on the body, like the dots, right? So there are kind of like a switch or button you press to you tell the machine to do something, right? So um, let's say you want the engine to go faster, right? You press the button that makes the engine go faster, right? So it kind of works similar in the on the acupoints as well. So you press or you stick a needle on these acupoints, and it will stimulate the channel or the internal organ in certain way that you will have some kind of like a therapeutic effect or some reaction from the body. I hope that kind of makes sense to everyone. So how to do acupressure, right? So first you want to get yourself in very relaxed state, right? So you want to be in relaxed position as well. So you can be either sitting down or lying down as long as you relax, and make sure you have like no tension on the body, right? So usually taking a deep breath in and deep breath out, and do that for a few times. That usually helps to bring tension down in the body, and then helps you to relax the every part of the body, right? So after that, you can locate the acupoints, and then you put the pressure on the acupoints, and usually anything between 1 to 3 minutes um, is ideal, I guess. And you do have like multiple points to cover, right? So you want to spend any time between 10 to 15 minutes in total to cover all the points that you want to press. So you can kind of like judge how long you want to press on it for, right? So when you put stimulate the point, you want to stimulate in a way that you put firm pressure, but you want to be gentle. Like so, the point will be sore, but so you want and that you want to stimulate the points right, but you don't want to stimulate it too strongly to the point it causes bruising, right? So just uh, use your own judgment in terms of how much pressure you will put on. um, and then there are multiple ways to do it. So you can simply put pressure and hold for a few minutes. You can push and make a small circle with your finger and stimulate the point, or you can do it in more like a pulsating way. So you can put pressure and hold for a few seconds and release, and then hold for a few seconds, press down for a few seconds, and release, right? Uh, so there are different ways to do it. So any method is fine. So you can just kind of decide what fits you the best. Um, and this whole cycle. So I was talking about how you can press the different points for in total 10 to 15 minutes. So that will be one cycle. You can repeat the cycle like once or twice a day. There isn't really let's upper limit per se, right? So you can press go do the cycle as many uh, times as possible. Just again, just don't press to the point it would cause bruising, right? So use your own judgment to decide how many times you want to do it. But if you decide to do, let's say you decide to do 2 cycle a day, right? Then you want to do like twice 2 cycle a day regularly for next like week or so, or longer than that, a month or two. All right, so some of the condition we'll cover today are the headache, nausea or bloating, anxiety, insomnia, menstrual cramps, constipation, and diarrhea. I added few points at the later at the end of the slides. If we have enough time, we'll go through them as well. But these are the main conditions that we'll go through, and then we will have about 3 to 4 points per condition. And as we talk about the points, you will notice that some points have multiple functions, so there will be overlap points between these conditions, right? Um, but it's so let's say you want to treat headache, right? So that you use the combination of points that share the function of treating headache, right? And that becomes a treatment protocol for headache. So don't panic when you see like a one point that has like 5 different function, right? So as long as you select the point multiple points that share similar function, then you're doing the treatment for that condition. Okay. All right, so first we'll talk about headache. This first point is large intestine 4. For short, we use LI4. So I might use it conversely. The Chinese name translate is junction valley, if that helps to kind of remember where the point is. So this point is located in the web between the thumb and the index finger, right? So you see in the diagram, you have index finger, thumb, and then it goes right there, right behind the web, right? And then this point will be sensitive on a lot of people actually. So this point is good for headache, any headache, but especially good for a frontal headache. So in the forehead area. Um, Other function it has, it's actually good for any like generalized pain, any pain in the head and face area, and also good for treating cold symptoms as well. So and then this point, so there are a few points that are not recommend to use for during the pregnancy. So this is one of the points. So pressing the point, just one single point won't really do much harm for the baby, but always better safe than sorry. So if you are pregnant, then I suggest not using this point. All right. Second point.
Sean, sorry, can I just interrupt for a second because someone asked me privately, and I just wanted everyone to know that
Mhm.
Sean has generously offered to share his notes at the end, and we will also be sending out the recording. So if you're struggling to like draw the picture or something like that, you don't have to.
Oh, thank you, Pauline.
Okay, go ahead.
All right. So yeah. So this diagram, I might. So if the diagram doesn't make sense, I might change when we send the file, the PowerPoint file. I might change the picture. So hopefully you will be able to just like actually see the picture and locate the point. Anyway, we'll continue going. So next point is liver 3. This translates to spleen surge. This is also very popular point. So this point is located on top of your foot, in the web between the first and second toe. This point also great for headache, but this point is especially good for vertex headache. So vertex is top of the head, right? And the temporal headache, so side of the head. So you can use liver 3 for those two headache. This point is also great for generalized pain, stress, dizziness, and depression. So this point has great function of soothing flow of energy in the body, and then so that's why this point is used very often. All right. Next point is Sanja 5. You will see different names for this point. So this can be Sanja 5, triple energizer 5, or triple burner 5. They all mean the same thing. The name how that translates to outer pass. Uh, this point is located on outer forearm, about 3 finger width. So you're using index to the ring finger. So 3 finger width away from the wrist. So it's in the middle of the forearm, the outer side. This point is good for temporal headache and also migraine. This point also have a few other functions, like this point is good for neck pain or stiffness. Um, and this point is on the wrist, right? So this point can be used for wrist or hand problem. Next point is bladder 60. This name is Kunlun is the name of the mountain in China, actually. This point is located, as you can see on the diagram, it's located right behind your outer ankle bone. Um, so this point is good for occipital headache. Occipital is where the back of head is, right? So you use this point for headache in the back of the head. Um, this point can also be used for neck pain or stiffness, most in the back, back pain as well, uh, lower back area, and locally you can also use this point for ankle and feet problem. Also, this point is not recommended to use during pregnancy. Just be aware of that. So next condition we will talk about is nausea and bloating. This point, stomach 36, is actually very popular point as well. This name translates to leg 3 mal. So how you locate this point may be a little complicated. So as you see on the diagram on the left, right? So you'll see how this index finger is starting right below the kneecap. So you want to go 4 finger width from starting the kneecap down, right? And the line that's going vertically is the tip of the shin bone. So you go finger width outer to locate this point, right? So a little bit complicated, but kneecap, finger width down, and the one finger width lateral, so outer that way. So that's your stomach 36. This point is good for nausea and bloating, but really, in reality, this point is good for all digestive system problems. So you can use for any digestive issue. Also, this point is really great for strengthening your body. So if you feel weakness in the body, be- uh, weak immune system, this point is actually good for boosting your immune system as well. And locally, this point can also help with the knee problem as well. Next point is conception vessel 12. The name translates to central stomach because it's in the center of the stomach. This point is located on midline of the abdomen. So this dotted line in vertical is the midline, and about four finger width above belly button. So you start from the belly button and you go four width up from there, and that's your point there. Uh, this point is good for nausea and bloating. Sorry. And since this point is right on the stomach, and then this can stimulate pressing this point can stimulate your stomach, right? So this point is great for digestive issue, especially for in this any issue in the stomach. Next point condition we'll talk about is anxiety. This point is pericardium 6, translate to inner pass. So, a few slides ago, we talked about Sanja 5, which was pass, right? So this is inner pass is actually on the opposite side of your forearm. So that's why they kind of shared a similar name. So this point is located on the palmar side. So it's on the inner side of the forearm, about three finger width from the wrist. It's right in the center of the wrist, as you can see on the diagram. This point is good for anxiety. You can also use this point for nausea and bloating. Problem in the chest. This point is known to open chest, and also this point is great sedating point, so you can use it for insomnia as well. Another point for anxiety, in tongue, so it's right there on right between your two eyebrows in the middle. Translate to hollow impression. This point is also another great sedating point, really good for anxiety. Uh, you can use this for a stress, right? So as I said, it's very sedating. Um, for local purpose, you can, since it's like right by the head area, you can use this for a headache, mostly for frontal headache. Also, this is close to a sinus and nose area, so you can use this for any sinus or nose issue as well. Another point for anxiety. So this is the conception vessel 17. So this translates to chest center because it's in the center of the chest. So you can find this point on midline, right between two nipples. I know our anatomy is a little different, so our location of nipple might be a little different, but this is very simple way to find like approximate location of the point. Um, this point again is great for anxiety. This point you can also use for stress, right? But since this point is right on the chest, you can use any problem in the chest, like a palpitation, like a racing of heartbeat, right? Or lactation problem, or hiccup close to the diaphragm as well, right? So you can use this point for hiccup as well. Okay, so next, insomnia. This point, heart 7, translate to spirit gate. This point is one of the key point for insomnia. Uh, just located on the underside of the wrist just under the bottom of the hand. I know the description might be a little bit tricky, but if you follow the diagram, it will be really easy to find. So you have the line for the wrist, and it's near the, where the pinky is, the line where the pinky is, right? So that's where the point is. And this point is great for insomnia. Um, Also, this is also great point for your spirit, very sedating as well. So that's why you can use this point for irritability, right? Also, this is a main point for heart channel. So any heart problem like a palpitation again or pain in the chest, more like a heart related pain, you can use this point to treat those problems. Next point, spleen 6. This is also a great point with many different function actually. So the name translates to three yin intersection because this is a point where three different yin channel intersect. So that's why the name is like that. You can locate the point like the picture, right? So you have your inner ankle. You use your four fingers and go forefinger above that ankle bone, and then you go behind the shin bone, and to find the depression. That's where the spleen 6 lies. This point is good for insomnia. Again, one of the prime points. This point has many other great functions. So you can use for any reproductive organ problem. You can use for urination issue. Also, this point, one of the main point on the spleen channel. Spleen channel is for digestion in Chinese medicine. That's why um, if you have weak digestive system, pressing this point is very great. Unfortunately, this is one of the point that is not recommended for during to be used during pregnancy. So keep that in mind. So one more prime point for insomnia. This is called anmian. This actually directly translates to peaceful sleep. So the name kind of indicates that the point will be great for sleep. So you can find the point. So you find the start with the earlobe, and then you can use a three finger behind the earlobe. So that's gonna be how far the point will be away from the earlobe, and then locate the point right underneath the base of the skull, right? Um, so this is also a very approximate area description of the where the point will be. Again, this point is great for insomnia, but since it's right at the where the neck begins, you can use this point to treat vertigo and headache. So insomnia, so in tongue again, so like I said, there will be many repetition of points, right? Because they do multiple things. So again, so the in tongue is located right between two eyebrows, and then has a great sedating effect. Helps you to sleep as well. Now for menstrual cramp, so this one is little spleens 8, translate to earth pivot. This point is a little tricky to locate. But how you locate is that you on your inner calf, right? So and then under the knee, bottom the kneecap, you do four finger widths twice down. Right? So you go once underneath kneecap and twice under kneecap, and then on that line you go you find the point right directly behind the shin bone. This point will be probably tender on quite a few people as well. This point is almost exclusively used for menstrual cramp actually, so you know how strong this point is. But you can still use for acute pain in digestive system as well. So you can, if you have digestive system pain, let's say pain in the intestine, maybe you can use this point as well. Again, spleen 6, very great point. So you can, like I said, that you can use this for reproductive organ problem, right? So menstrual cramp is one of the, that problem. So you can use this point to help relieve the menstrual cramp as well. So just to quick recap, forefinger width above the inner ankle bone, right behind the shin bone, right? So it's just like the picture. Again, not recommended to use during pregnancy. Uh, Another repetition. All right, again, large intestine 4. So I talked about how this point is great for general pain, right? So you can use this pain for menstrual cramp as well. So again, look at this point between the web between your thumb and your index finger. Again, not recommended to use during pregnancy. Uh, so now we'll talk about constipation. So this point is called kidney 6. This called shining C. So you can kind of imagine C is used to kind of moisturize your body to help you move the ball, so help with the constipation, right? So this point is about a finger width under the inner ankle bone, right? So you have ankle bone here, and then about a finger width down, right below the ankle bone. This point is mainly used for constipation, but you can use this point to help menstruation problem, insomnia, and or hot flash as well. Um, Next point is Sanjiao 6. So we talked about Sanjiao 5 previously, right? For temporal headache, but now this is next point. So it's only a four-finger width from the wrist, so it's slightly further than Sanjiao 5. Uh, this point is translates to branch ditch. Um, so this point is mainly used for constipation. So again, you can use this point for, since it's close to wrist, you can use this for wrist problems as well, but you can use this point for ear problem as well, like ringing the ear or reduced hearing. Another great point for constipation is stomach 25. It's translates to celestial pivot. So it's located on the same level as umbilicus, about three finger width away on both sides, away from the umbilicus. So it's right at the belly, so you can kind of think that it will help with your belly, right? Where the intestines are. That's why it's great for constipation. But any intestinal issue, even for diarrhea or dysentery, any other issue, you can use these points. All right. For other point for constipation, stomach 37. So it's the next point to stomach 36. Translate to great upper hollow. Um, So you know how you located your stomach 36 forefinger width below the kneecap, right? So for 37, you're going to do that one more time. So you're going to locate stomach 36 by going forefinger width below the kneecap, and then we're going to go one more time to locate stomach 37. This is still a finger width away from the shin bone because it falls on the same line. A little tricky, but this is a really great point also for the intestine, mainly for the large intestine actually. So this is great for constipation, but this point can be also be used for diarrhea as well. So you will see this point again in very near future. Okay, so diarrhea. So again, there are many repetitions because they're both like problem in the intestine, right? So again, stomach 25, same level as umbilicus. You use three finger width, sorry, from the umbilicus and go on both sides. Again, this is good for diarrhea. You can use for constipation as well. Uh, Same point again, stomach 37. So a quick recap. So kneecap, you go four finger width and one more time, and you go and on by the shimbo you go one finger with outer side, right? So that way, right? So That's you find how you locate your stomach 37. Again, this is point is great for large intestine in general, so great for both diarrhea and constipation. This point is for diarrhea as well. Spleen 9. The name translates to Yin Mound Spring. This point little tricky again. So you're on your inner thigh, just like the diagram, right? On inner thigh, you are going again forward with below the kneecap, right? So you're but this time you're on the inner side of the calf, right? And you locate this point right behind the shin bone, right? So you you know how we find the stomach points right beside the shin bone on like kind of like a front of the lower leg, right? So this point you find on the inner side of the calf. um, this point is great for diarrhea, but this point is actually used a lot for many other issues, mainly for like a water water issue. So let's say problem like edema or like urination or feeling heaviness in the body, you use this point. Locally, this point is also close to knee, so you can use this point for knee problem as well. Okay, so I think we covered all the conditions. So this figured, we're in the middle of the pandemic and everyone's worried about COVID, right? So kind of, so I figured I added a few points that helps relieve flu-like symptoms, right? So like sore throat, coughing, and all this fever. So I added three more points. So I think more the better, right? So all right, so this point is large intestine 11. The point translates to pool at the crook. So you locate at the outer fold of the elbow when it's flexed, right? So you see on the diagram, you see this line by the elbow. This is fold, right? So at the end of the line, this is where the point lies. um, this point is has a great cooling effect, so you use for fever, any fever or feeling hot sensation, right? um, Also helps with dryness as well. So um, but like if you have flu like symptoms, you have fever, dry coughing, so you can use this point to relieve those symptoms. um Lungs, this is lung 7. This is also great for flu-like symptoms. So you can locate this point about 2 finger width away from the wrist, close to thumb. Another quick way to find it is you just have your hands crossed from each other, and where the index finger is where you can locate the point, like on the same line where the thumb is, right? And where the index finger is. This is also great for flu-like symptoms, also, but also great for cold-like symptom too, right? So you can massage this point to relieve cold or slash flu symptoms. Sorry, forgot to add on the slide, but do you everyone remember the large intestine 4, the point that's between the thumb and the index finger in the web? That point also can be used for cold or flu-like symptoms, so you can use press those point as well. Um, Last point I'm gonna talk about because I know I've seen many patients with fingers and toe problem, especially neuropathy. This point will be great to massage as well. So ba xie is the finger, the point on your hand. You see the 4 points right between the in the at the edge of the web between 4 fingers, and the ba feng is the point between the toes on the web, right? So on the left on the hand is a ba xie, on the right is the foot, is the ba feng. So these point you can they are great for helping with the finger and the so ba xie is on the hand, so it's good for fingers and the hand problem. Ba feng is on the toe, between the toes, so it helps to help with the toe and the foot problem as well. All right, so if you have any issue in your hands and the feet, you can try massaging this point as well. Okay, so those are all the points I have today. I know we went through them quickly, but we will send out the PowerPoint, so you can review. You can look at the pictures again to kind of like remind yourself where the points are. Okay, so I think that leaves quite enough time for the questions.
Awesome. Thank you so much, Sean. Um, okay, so there were a lot of questions. Some
Oh
people
boy.
sent it to me. Well, I mean, not a lot, but quite a few, which is great. It's good to see people so engaged. So I'm going to just send, why don't I send a list in the chat of all the questions I gathered?
Hmm.
Well, why don't I just ask them one by one to you, Sean,
Sure, sounds
so
good.
that you don't need to read it. Okay, so someone was wondering, what does regular intervals mean?
So regular interval means you're looking at the per day, right? So if you were to do, like I said, if you decide to do, sorry, 2 cycles a day per day, then you will do two per day, like regularly. So it's more, yeah, you look at more day uh, in terms of interval, if that makes sense.
Like once to twice a day, you're saying?
Yes, yeah.
Okay, and then someone asked, do you mean several times in the day?
Several times. So once or twice is okay, but like I said, there's no upper limit. You can do multiple as many times as you wish. Just that if you decide to do a certain number of times, then it's better to stick to it. And then do like you decide to do 5 times. You be ambitious to 10 times. You do 10 times. You do 10 times the next day and the day after, so forth.
Okay, so there's some related questions to this actually.
Mhm.
So someone asked, is there a maximum number of times you can press each point?
Um, there isn't like I said, there isn't like a upper cap in terms of how many times you can press the point. But again, just as long as you don't press it so much to the point it causes bruising, yeah, I think it's fine.
Okay, and then how many times do you have to press each point before you notice the effects?
That is a good question because depending on person and depending on cases, um, this will be very different. Let's say you have like an acute headache, right? So when you press on the point, just do 1 cycle, you might feel the difference because you only had the symptoms for a very short period of time, right? If you have let's say chronic constipation for all your life, you doing once probably won't really make a big difference. So um, essentially the rule of thumb is longer you had a problem for, the longer you will have to do um, the treatment, so self massage. And depending on severity of the condition, you it might take longer to see the effect of the acupressure.
Okay, thank you. So a couple people asked, do you have to do both sides, both wrists, both hands?
In general, it's recommended. If I know for practitioners, right, who are more advanced, they kind of know they can decide which side is stronger in terms of therapeutic effect. But if you don't have like a strong TCM training, that might be a little tricky. So I do suggest you doing both side to start.
Okay, and what are the other tools that can be used to apply the pressure? Someone asked.
Oh, okay. Oh, actually, I happen to have this. So anything that is that has like a sharp, not super sharp because you don't want to be poking at it too hard, but sharp but has like a little bit of round edge at the tip will be good. So actually, this is a horn from a cow, I believe. So I sometimes use this to press myself. Um, there, so it's not really limited to certain tools. You can even use like a pen. Uh, Sorry, let's say a pen, right? So you can use like the other side of the pen to push it to. Um, yeah, as long as you can stimulate it and then not be too painful from it, that's okay.
Okay, good. So a couple of people asked about tenderness. If you don't feel tenderness on the point, does that mean you don't have the right location?
That's a trick question. So, so some points may not be as sensitive, right? So you still might be on the right point, but uh, uh it's just not as sensitive as other points. So I wouldn't be worried too much if you miss the point because you don't feel the tenderness.
Okay. And someone else asked, uh, kind of similar, does ten is tenderness a good sign that you're getting the right spot?
Um, it I would say it's a good sign. So again, so if you don't feel the tenderness, that doesn't necessarily mean it's a bad sign. But if you do feel some tenderness, then that's probably a sign that you're on the right point.
Okay. Um, thank you. Someone was asking when you press down. I think this was for the first one you did, LI4.
Hmm.
So they asked when pressing down, does anyone else feel a nerve light up or a weird sensation through the ring finger?
Through the ring finger. Oh, ring finger is quite rare. But so I think most of people here had acupuncture before, right? So and then after receiving acupuncture you feel different sensation like heaviness, like dull achy sensation, or even sensation down or up the channel, right? So this is similar. So it is, I would say it is like a normal reaction or sensation you can get from pressing the correct point. Just that you don't want that sensation to be too strong to the point it bothers you, right? So just maybe if the nerve sensation bothers you, you can like kind of back off a bit and then go easy on the pressure.
Okay. Great. Oh, hold on. I have to mute someone.
チャンスか
Hold on. Someone is not muted, but I can't figure out who. Oh, this person. Okay. Okay. So let's see. Some people were asking a bit more detail about the
Mhm.
cycle. So if you could describe the cycle and also with the different points, is there a specific time, like number of minutes, to do each one of them?
So start with the latter question first. So there isn't really a specific time, like a duration or time that you have to press per point. Um, so I mentioned earlier in the beginning about how you do like a combination point, and that's good for like that makes a treatment plan for like a certain condition, right? So that's why if you were to press on one point, then I would also press the same amount of time for different point as well. Um, in terms of how, so what was the first question? Like how many times
If you
per
can
day?
describe the cycle, because you were saying cycle, do a
Uh-huh.
cycle and do another cycle. What does that mean?
Cycle is more like you know how you do like a workout, you do like you say like a 5 reps of three, right? Three uh shoot, I forgot the word, but a cycle as in you, let's say you were doing point for headache, right? So I decide to do this point and then this point. So you do 3 minute on this point, 3 minute on other side, 3 minute on this point, 3 minute on other side, and that's like a one cycle, right? So that's a set. Sorry, that's a word. That's a set, right? That's what meant by a cycle. So you have this one set, right? And you decide to do 3 set a day, then you repeat that like 1, 2, 3, 4. That's one set you. So you repeat that how many times you decide to do it a day. So let's say you decide to do a one set uh when you wake up in the morning, and then one set before you go to bed, right? Then you just keep it as regular as possible. So next day you wake up, do one set of treatment, and before going to bed you do other set, and then you go to bed. So I hope that kind of gives you a general idea. But like nothing is like set on stone, so you can kind of take build your own schedule according to however your lifestyle is.
Okay, awesome. Thank you. Someone asked about a pressure point for shoulder tension.
Oh, shoulder tension. So shoulder tension. So the let's say, so local point on the shoulder is actually pretty good. So if you locate the point on top of the shoulder, I'm assuming shoulder as in like a neck and shoulder, right? More like a trapezius area, I'm assuming.
Probably.
So you can locate the point like right on top of the muscle. You can press this point on both sides. That helps to relieve the tension from the neck. Also points on the back of the head. So here, so it's very close to the point we talked about for sleeping, right? So point is on the base of the skull. This is gallbladder 20. This point is actually great, really great for neck tension as well. Distal point wise, I like to use the Sanja 5, the three finger width from the wrist, that point, and the liver 3, which was imagine this was my foot, right? Then the top of the foot between the big toe and the second toe and the webs. That's liver 3, right? So those are the points I like to use for the neck tension, neck shoulder tension. Sorry.
Okay, thanks, Sean. Someone was very excited about that and requested a picture.
Oh.
If you've
Okay.
got any time when you're preparing your notes. Okay, there's a few more questions. So let's see. Oh, where did my questions go? Okay. Um, is it safe to do this on children, specifically 4 years old?
Acu Acupressure on baby are actually safe, so you can do that with no problem. Yeah, yeah. So you don't have to worry about doing for. You can do acupressure for any age. So yeah, you don't have to worry about doing on the children.
Okay, thank you. If you don't get the right spot, can you do damage?
No, no, actually, no damage. I mean, only damage you can really do is press really hard and cause bruising. Neat thing about acupressure or acupuncture, you rarely ever do damage on your body, even if you select wrong point. Um, so yeah, so don't worry about missing the not getting the right point. Um, as long as your location is approximate, like pretty close to the point, it will still stimulate the channel, right? So we saw the channel pathway where the energy flows, right? So if you still miss the point but still be able to stimulate that line, the channel, then you can still have some benefit, some therapeutic effect.
Okay, thank you. And then someone is asking, what about tenderness referring to another area?
Are we talking about when you press the point and then it causes tenderness in other area?
I'm not sure. This was written in the chat.
Hmm.
Does the person who wrote that question want to clarify? I, I will wait for the clarification.
Okay.
Oh,
Okay.
yes, the person wants to clarify. Oh, yes, you mean what Sean said is correct? I guess that is what they mean. Oh, yes, that's what they meant.
Okay. Okay. Um. So, like the diagram, right? So our body is connected, very sophisticated, connected by through these channels, right? So sometimes pressing on the point will cause sensation in different part of the body. So um this is actually not a bad sign, a good sign if anything. So yeah, this is one of the normal reaction you get from pressing the acupoints, I would say.
Okay, thank you. Someone was asking about points for neuropathy in the hands.
So neuropathy is a little tricky to massage, but I would the points I would use is the large intestine 4 and liver 3 on your foot. So those are good combination for general pain and then increased circulation in terms of blood and energy. So more circulation to repair your body, right? And then plus, if it's hand, then you can use the bashe, right? The point I mentioned on the hands on the tip edge of the whip, and also you can some point other point you can use is either the PC6, the inner pass, or the outer pass, the Sanjiao 5, depending on where the neuropathy is. So the location of neuropathy does matter a bit, but those will be general point that you can use to kind of relieve or recover faster.
Okay, thank you. Okay, there's a few other what point would you use for this thing, but I'm just gonna put in the chat in case anyone needs to leave early. We do have a feedback form, so I mean not early, we're almost at 7, but in case anyone needs to leave right on time, if you don't mind filling in our feedback form before you disappear, that would be great. And for those of you who are able to stay, we do have just a couple more questions from all of you. Okay, so is there a point to stop food cravings or hunger?
Oh, okay. I'm assuming it's like a excessive appetite. Actually, ear acupuncture works pretty well for reducing appetite for diet, but obviously, ear is like a very tiny system, so it's very difficult to stimulate those each point. But one point I would use for excessive hunger is stomach 44. It's on the foot actually. So I'm gonna so pretend this is my foot, right? So you have the big toe and the second toe and the third toe. This point lies between the second and third toe on the web, right? So I don't know if that makes sense. But yeah, so that would be like the main point I would use to reduce the appetite. I guess the other point you can also use is to the conception vessel 12, the middle of stomach point. That helps to regulate the stomach function as well. So you can try pressing that point as well.
Okay, thank you. Let's see. What is more effective, acupuncture or pressure point treatments?
I would say acupuncture is would be stronger in terms of therapeutic effect. Because the needles are very thin, they're very like on the dot in terms of the point, right? And it can stimulate deeper layer of the body. So I would say acupuncture would have stronger therapeutic effect, but of course you can't do you can't do self acupuncture at home, right? If you don't have training, that's why we strongly suggest you to do acupressure treatment because it still has a good therapeutic effect.
Okay, so there's still a couple more questions. So do you have any good books or resources to recommend for beginners?
For beginners, that's a tough one. Pauline,
Yeah,
do you have
I
any
know.
suggestion?
No.
Oh.
I mean, there are some books that are good
Mm,
to recommend Chinese medicine for beginners,
mhm.
like Between Heaven and Earth or something like that. But acupressure specifically, I'm not that familiar with books specifically for acupressure.
Okay, so I guess we'll do some
But we'll
research
think
and
about
then
it.
yeah.
If we come up with something, we will send it along.
Mm.
Someone's asking about a point for fertility.
Oh, it's So fertility is a little tricky because there is like a few different causes of like infertility per se, right? Um, but I guess if I were to pick 2 points good for fertility, I would pick kidney 3. So UB, the bladder 60 that we did right on the outer side behind the ankle bone. This point is on the inner side of the ankle bone, so right behind inner ankle bone. So that's kidney 3. So um, that would be great point. Also, the point on your lower abdomen, that's more like local, right, for to your reproductive organ. So one really great point is called a conception vessel 4. So I would locate the point. Do from the belly button, you go about 4 finger widths below your belly button, right in the center, right? So that's really great point for any reproductive organ problem, or just to benefit the organ in general. So I would probably use those 2 points the most.
Okay, there are a few more questions and they keep coming in. But I just wanted to pause here because I know that some people are having to leave. So I just and we'll stay behind for a few minutes and keep asking, keep answering some questions. But thank you everyone for attending. We do like to get feedback after our workshop. So I pasted the feedback link into the chat. It's just hillgreen.ca/feedback. It's just a quick little survey, so we would appreciate any suggestions people have for improving our workshops in the future. Of course, the information here is very general, as you know. So one of the strengths of Chinese medicine is it's a very personalized medicine at its best. So if you do, I know some of you are already working with one of our practitioners, but if you want more personalized support, we do offer free consultations for people with Sean or with any of us. So you can just email us, or you can actually just indicate it in the feedback form that I just sent out. So just check off that you'd be interested in a free consultation and we'll get back to you. So that would, we use acupressure, but we can also use acupuncture and moxibustion and cupping and herbs and all that kind of thing. And then Oh, I guess that's it. So Sean very generously has agreed to share a copy of his PDF notes in a PDF form, and we'll be sending that out as well as a recording of today's workshop. So stay registered for the workshop and you should get it in your inbox. If you have any trouble, then just email us. But do give us a couple days to process that first. And yeah, so thank you everyone. And I'll just continue with the questions because there are a couple more questions. So a couple people want to know about cold hands and feet. What would you recommend for that?
Okay. So cold hands and feet. So again, large intestine 4 and the liver 3 to increase circulation. And then I would use the bafeng and bashi, the hand one, right? Those will be probably your best. But if the circulation, the poor circulation is leading to cold hands and feet. If it's because of your, like, let's say anemic, less blood count, then there um some other points you can use. Spleen 6, right? The inner ankle, 4 fingers up, and that's a good one. And also stomach 36, the four finger was below the kneecap, the foot 3 mile point. Those will be great for anemia type of cold hands and feet, like a less blood.
Okay, wonderful. Thank you, Sean. And then there's kind of a funny point question. Is there one magical solve all point?
I wish. I mean, if there was such a point, I guess, like, we don't need much training. We just use that point. But
That would be
uh,
handy.
yes, very handy. Unfortunately, there isn't such point, so I'm sorry to disappoint you.
Okay. Okay, so I think that's it for the questions that we have, unless I missed something. Let me just check. No. Oh, can you overstimulate by doing too much at one time?
Overstimulation would be, I guess, like you will know you overstimulate because the point will become like more and more sore and tender. So if you do notice that the point is getting like really sensitive, then you probably want to back off and take it easy. But in terms of internal side, right? Let's say you're pressing this point for a headache. You There isn't really a way to overstimulate the point, so you make your headache worse, per se. So yeah, there's that.
Okay, thanks, Sean. Um, JK, I don't understand the question. It says NL several different channels.
It's in relation to the last question. I wasn't talking about a specific point. I was talking about if you're stimulating the spleen and the foot and the this and the that, all these different areas at one time, if like that kind of overstimulation is
Okay. I see what you mean. So that's why, even though, let's say, there are 60 points that are good for headache, per I'm using headache as a example, but you we don't use all 60 points, right? Because it's necessary, unnecessary, and it's like using all 60 points versus using 4 points that are like a key to the headache won't really make a difference, right? So if anything, I would say stimulating all the points in the body will, in a way, kind of confuse your body, right? So it won't be as effective if you use too many points, right? So that's why a lot of acupuncture practitioner, acupuncturists, they don't use well, at least at our clinic, we don't use like 70 needles at once, right? Because it's not necessary, and then you might confuse the body a little more. So that's why we, in a way, like limit the number of the needles we use. So I would suggest, like, if you were to give selective points to, do acupressure, don't use let's say like 30 points all at once, if that makes sense.
Yeah. Okay. Well, I think those are all the questions that we got in the notes. So again, thank you everyone so much for coming, being so engaged. Thank you, Sean, so much for all the work you did to prepare the information in such an organized way. And yeah, please keep in touch. So as you know, we've got 3 locations, and we're very friendly people. So we're happy to do the free consult and find out more about each of you and what facing, and see, maybe acupressure is sufficient for what you want to deal with, or maybe you want to get some additional support. And there's lots of different ways that we can work with you in that way if you want. So I will post once again the link to our feedback form. You can use that to let us know what you liked, what you didn't like, what you would improve, and if you have any ideas for future workshop topics. So we're hoping to keep giving some free webinars, throughout the year. So we welcome your suggestions as to what you would find useful and interesting.
Thank
So
you.
thank you very much.
Thank you for your time.
Our pleasure.
Thank you so much.
Thank you for coming.